Thank you, Chairman Dugat, and I appreciate your holding this hearing. We owe our nurses and doctors and all of the frontline healthcare workers an enormous debt, and the title of this hearing, Lessons from the Front, really drives home what I believe is the point that we have to listen to our healthcare workers and give them the supplies and the support and the resources that they are asking for. And though they're not here at this hearing today, I want to recognize that the labor unions that represent frontline healthcare workers have provided a path for critical health and safety protections for workers and for patients. And for this reason, I would ask to put into the record a December 2021 report from National Nurses United, the largest national union representing registered nurses from around the country.
Without objection, so ordered.
Thank you. The nurses and healthcare workforce is in crisis. And it has been for actually a long time. And we know that there is a shortage of good paying permanent nursing jobs where nurses are fully valued and their work for their work at the bedside. And this is exactly why we need to invest in permanent jobs with good wages and benefits and safe staffing standards. I am very proud that I have introduced legislation and leading the legislation called Nurse Staffing Standards for Hospital Patient Safety and Quality Care. I'd like to ask Dr. Rani, in reviewing your written testimony, I noted that I noted and appreciate actually that you referenced the dire need to implement minimum nursing standards. And I wondered if you could talk more about the science and the evidence that backs up the need to have minimum nursing staffing ratios.
Absolutely, and I can share specific studies after the hearing. I don't have all of the exact numbers at my fingertips, but the short version is that there's ample evidence that having low nurse to patient ratios improves patient outcomes, decreases patient mortality, decreases staff burnout, not just for nurses, but also for the rest of the team. Asking nurses to take care of more than a certain standard number of patients with a lower number of patients acceptable in the intensive care unit compared to on hospital floors. But going past that limit increases, again, both patient harm and nurse and others burnout.
That the lack of the any kind of staffing ratios and is a reason for burnout of nurses, that they just feel overwhelmed. And we do see a flight of nurses that was mentioned by one of our other witnesses, and that would help to keep people on the job. Dr. Rand?
Absolutely. Thank you. That would absolutely help to keep people on the job. Speaking to nurses that are in states that have nursing staffing ratios versus those without, there's a really big difference in terms of their quality of care provided, their levels of burnout, and their willingness to stay there.
So I really appreciate that, but because we're talking not only about the nurses themselves and their ability to stay on the job, but I think the data that you referred to that shows that the outcomes for patients really improves. I've talked to nurses who are so worried that they have not been able to make sure that the medication is correct, and we know that there is a good deal of harm that happens in hospitals that some of which can be attributed to the fact that the nurses can't spend enough time. So I just thank you for that, and you know, we want to do everything we can to make sure that both the workers and the patients have what they need as we go forward. And so I yield back. Thank you.